Hello, everyone. Thank you so much. And today it's been an honor to speak to you guys about a distinguished topic that has been my passion for a quite number of few months. So, first of all, I want to talk. My presentation is about how predictive analytics and AI are reshaping epidemic response and public health surveillance. So, as you guys know, my name is Rukshanda Rahman, and I'm currently pursuing my master's in computer science. And I will just have a brief discussion about how AI-driven technologies in combating and preventing infectious diseases. So, first of all, we all know that how epidemic response it has been always been a critical challenge for public health and for the authorities as well. As we have seen during recent events like COVID-19 pandemic and early detection about the rapid response are key to preventing widespread outbreaks. So the traditional methods that we generally use that have served us well, but in the face of increasing complex health data, we need more advanced tools to provide timely and more accurate insights. So, as we enter into artificial intelligence and predictive analytics, which are providing us with the capability and also to anticipate outbreaks and also optimize the resources and save lives. Save lives. Thank you. So, for the overview, the key point of my presentation today will be how we can integrate AI into public health strategies that leads to more effective and timely interventions. So, this can result in saving lives and resources as well. So, what exactly will we talk about today? When we say AI in public health, it usually refers to machine learning algorithms and data analysis techniques to process massive amounts of information, more than any human can process this, and it amounts to a massive information more than any reasonable person can handle. So using predictive analytics, which is powered by AI, we can help it can help us forecast future trends by identifying and the patterns in historical and real-time data, which is especially crucial when it comes to disease outbreaks. So, the power of predictive analytics. Now, let us consider how predictive analytics enhance disease prediction. So, as we all know, that we are currently living in an era where data is generated at an unprecedented scale. Social media posts, electronic health records, environmental sensors, all of these are rich sources of information. So, AI-driven analysis it processes this vast data to pool to identify warning signs that a potential outbreak might be brewing. It's not just about looking at isolated incidents of illnesses, but it's more of a like it's seeing the bigger picture into it. For instance, AI might detect an unusual uptick in flu-related tweets in a particular city or a pattern of higher than expected respiratory issues in a hospital data. These have the capability to predict outbreaks well before they escalate. With this information, authorities can help deploy resources proactively rather than reactively. And it also reduces the spread of diseases before it becomes unimaginable, unmanageable, and beyond our control. So, the key takeaway of this predictive analytics is that early detection made possible by predictive analytics it can prevent widespread transmission, and it also reduces the burden on healthcare systems and ultimately saving lives. So, talking about AI in outbreak management. So, before predicting when and where an outbreak might occur, AI plays an instrumental role in managing already ongoing outbreaks. For instance, traditional methods of responding to epidemics are often hampered by the inability to process large data sets quickly. So, in here, AI steps in to identify trends and patterns that might escape human analysts. Machine learning models can analyze real time data from various sources to give health officials an up to the minute and real time view of how an outbreak is progressing. So, let us consider how real time insights allow health authorities to make informed decisions about quarantines and about treatment protocols and about public health messaging. By using AI to process data, health agencies can adapt to changing conditions and respond in a way that is both fast and effective. So we all know that how AI's ability to provide real-time and actionable insights, it enables quicker and more effective responses during outbreaks and potentially saving thousands of lives in the meantime. So here is the chart of how AI adoption in epidemic responses have changed for the last 8 years, as you can see from the graph. And also there is a pie chart of how we can benefit as a society in whole as for AI-driven epidemic management. Like we can have fast response, we can have early detection and improved decision making. In terms of optimizing resource allocation, the one crucial benefit of using AI in epidemics is its ability to optimize resource allocation. In the chaos of an epidemic, one of the biggest challenges that we face is ensuring that the resources, for instance, medical supplies or hospital beds and healthcare personnel, all of them are allocated where they are mostly needed. So AI-driven predictive models, it estimates the demand for critical resources and help ensure that these are distributed efficiently. For example, by analyzing infection rates and demographic data, AI models can predict the surge of patients in particular areas and pre-allocate resources accordingly. It will ensure that regions in need are left under-resourced, while also that others are not sitting and with unused supplies. So we have to use AI efficiently for the resource allocation as it will reduce waste and ensure that the public health funds are used in the most efficient way. For continuous public health surveillance, one of the key challenges in public health is the continuous surveillance required to detect potential outbreaks early. So, AI offers an automated solution to this problem. Using advanced algorithms, AI systems to monitor vast streams of data and continuously looking for anomalies that could signal the onset of an epidemic. This constant monitoring allows public health authorities to identify and respond to potential threats for faster than ever before. The result is a more resilient public health system, one that we constantly, as citizens, we will be constantly vigilant and able to react a threat that grows out of control. So first of all, the key point over here is that it is AI-driven surveillance, and it enhances our ability to detect and contain public health threats early. And it will also reduce the impact of epidemics. For ethical considerations and collaboration, of course, we all know that there is no discussion of AI would be complete without addressing the ethical considerations involved. The first of all, the integration of AI into public health, it must be done very carefully and very logically and with a keen awareness of the potential challenges. We all know that to ensure that AI applications are ethical and secure and equitable, so that there are no real concerns around data privacy of the patients, there are no algorithm biases, and the equitable access to AI driven healthcare solutions is accessible to everyone. For this, AI needs to fulfill its potential. We must build a trust and ensure that the technology is used responsibly so that the patient's data is not, it does not goes to wrong hands. Another important takeaway is that I want to talk about collaboration. So the most successful implementations of AI in public health come from collaboration between technologists. So healthcare and professionals and policymakers. It's this interdisciplinary approach that will allow AI to have the greatest impact. So, in order to have a collaboration and ethical considerations, we must guide the integration of AI into public health to ensure that its benefits are maximized while also minimizing the potential risks of it. So these are some of the research questions that I came across while I was doing my research. So first of all, the question was, how can AI-driven predictive analytics improve the daily detection of epidemics? So I found out through research and by reading other journal papers that the role of AI in identifying how it can uh, identify patterns and trends that precede outbreaks, and also what are the potential benefits and challenges of integrating this into our public health surveillance system. So we need to balance between exploring the enhanced predictive capabilities and also ensure that the challenges and the ethical considerations while implementing this is within our capabilities. And other research questions are like how can AI and predictive models optimize the allocation of public health resources during an epidemic? So, during my research, I examined how AI can assist in distributing medical supplies with healthcare personnel and other critical resources more efficiently, and also the ethical considerations that we need to take into consideration. So, in for summary, I want to conclude my presentation saying that the integration of AI and predictive analytics into public health represents a major leap forward in our ability to not only respond to epidemics, but also using the latest technologies that have the power to fundamentally change how we approach epidemic response by providing early detection, optimizing resource allocation, and ensuring continuous surveillance. However, as we all know that Spider-Man said, with great power comes great responsibility. So as we move forward, it is very essential for us to ensure that AI systems are used ethically and that collaboration between all stakeholders is prioritized. And I also firmly believe that embracing AI and predictive analytics is not just an option, but now in 2024, it has also become a necessity. It is time to build a more resilient and responsive public health infrastructure that is better to face the challenges of tomorrow. Thank you for your attention. And one call of action is that by integrating AI and predictive analytics into public health strategies, it's not, as I said, it's not an option, but a necessity. Okay. So I appreciate your time and your interest in this presentation. So I would like to open the floor for any questions. Please feel free to ask any questions regarding my presentations about the public health surveillance and the epidemic response. Thank you so much.